My name is Professor George Boatinche. I'm the chair of the Antimicrobial Stewardship Committee at the Embassy of Ghana Medical Center. On behalf of the whole hospital, I want to wish everyone at UGMC happy World Antimicrobial Awareness Week. Antimicrobial resistance is a huge problem in the world, killing over 1.3 million people every year worldwide and contributing to about 5 million deaths. So this is a huge problem, especially in developing countries like Ghana. That is why we are celebrating this week to bring awareness to antimicrobial resistance. So who are those who can help to reduce this menace that is causing a lot of problems? So first is healthcare professionals. So if you're a doctor and you're hearing me, prescribe antibiotic only when it is really needed. If you need to do a test to check for a virus, do so that you reduce the antimicrobial prescriptions. If you are a pharmacist and somebody comes with a cough and a little, nasal discharge and is asking for antibiotics, try to convince the person to hold off, and the virus is likely to go away without any need for antibiotics. And then also, if you're a farmer, don't feed your animals with a lot of antibiotics, because this also gets into the system and then it gets into our body through the food chain. If you're a nurse, it is recommended that when the antibiotics is written, you give it as quickly as possible. And lab personnel can also help by making sure that microbiology results are quickly communicated to doctors and other healthcare professionals so that they can make quick decisions on patients. So if we all play our part, we should be able to reduce this problem of antimicrobial resistance and make it easy for us to treat our patients, because now a lot of patients come in with very, very resistant bacteria, and sometimes you don't have any option at all, which means that the patient is going to die. And sometimes you have options, but they are not good options, though. So there are antibiotics that have a lot of toxicity on the liver and on the kidney and other organs. And sometimes you don't have any option but to use those antibiotics. But if we all play our part, we should be able to help with this problem. On behalf of the management of UGMC, I wish everyone a happy World Antimicrobial Awareness Week. Thank you.
Antimicrobial resistance is a cancer that affects all aspects of healthcare, having been declared by the WHO as one of the top 10 global public health threats. Pharmacists at UGMC and other pharmacists have been very instrumental in enforcing antimicrobial stewardship principles. In UGMC, pharmacists lead and are part of infectious disease rounding, policy development, guideline development, education and training, and a whole lot. But I will still urge pharmacists to even do more in fighting this menace. Pharmacists are encouraged to participate in more research activities, develop and gather data that will help and inform policy change, and play their roles on the wards to optimize patient antimicrobial therapy. I am a proud antimicrobial stewardship guardian. Come on board. Thank you.
Hello, I'm Andrew Seaton. I'm an infectious disease physician from Glasgow in Scotland, and I chair the Scottish Antimicrobial Prescribing Group. I'm here with colleagues from Scotland as part of the Commonwealth Partnership for Antimicrobial Stewardship, working with in collaboration with 6 hospitals across Ghana, including UGMC. And I've been really, really impressed with all the fantastic antimicrobial stewardship work that's going on around Ghana, and particularly in UGMC. And I really wanted to just emphasize the important role of pharmacists, but not just pharmacists, but the wider clinical team, physicians, nurses, and other healthcare support workers in taking care of antibiotics. The key message is we need to use less antibiotics, we need to use more access to antibiotics, and we need to use shorter durations of therapy. And I think all these things will help reduce the overall use of antibiotics and unnecessary use of antibiotics, and will help support our fight against antimicrobial resistance. Thank you very much.
Hello, my name is Nana Amabwediba-Osei, the Antimicrobial Stewardship Program Manager at UGMC. Antimicrobial resistance is one of the most significant global health threats today. As healthcare workers, it's our responsibility to prescribe antimicrobials appropriately and teach our patients to use antimicrobials wisely. Let's all come together to stop AMR. Thank you.
Hi, my name is Angela Piafofo. Antimicrobial resistance makes it difficult to kill infections, and as health professionals, we should use antimicrobials rationally and encourage our patients to do so. Let's stop AMR resistance in its track.
Hello, my name is Fran Kerr and I am a pharmacist visiting University of Ghana Medical Centre from Scotland. My job is working to keep antibiotics working. Antibiotics are a very precious resource that we have, and if we don't use them properly, we won't be able to rely on them in the future. Antimicrobial resistance is a term that's used to describe when infections that were previously treatable are now no longer treatable by antibiotics. And so what I would encourage you to do is to use antibiotics only when they're needed, and healthcare professionals have a huge opportunity to educate colleagues and the general public on the dangers of misusing antibiotics.
Greetings team, my name is Sibon Jamie Jare, the Infection Prevention and Control Manager. During this Antimicrobial Awareness Week, let's underscore the importance of infection prevention and control. Prevention is our first line of defense. Regular hand washing and proper sanitation are crucial. Only use antibiotics when prescribed by a certified healthcare professional to help reduce resistance. Stay informed and spread the word about antimicrobial resistance and responsible antibiotic use. Remember, IPC isn't just about preventing infections, but also controlling them when they occur. Your dedication makes a world of difference. Together, we can forge a healthier future. Together, let's resist the resistance. Thank you.
Hello everyone. Antimicrobial stewardship is an essential component of clinical practice here in the University of Ghana Medical Centre, and our management, recognizing this fact, has set up a robust antimicrobial stewardship program. On behalf of the AMS team here in UGMC, I would like to encourage each and every single one of us to use our antibiotics judiciously, and also like to let you know that antimicrobial stewardship is a shared responsibility, and it involves every single one of us, regardless of your professional background. So let's all get involved. Thank you.